And Dr. Ish, what do you do to manage your case of cardiophobia?
I've done different versions of like exposure therapy, right? I will purposely do things that raise my heart rate now, right? If I'll go for a walk and then I'll make it a little more strenuous and I'll monitor it right here and know, hey, it went up and it came back down, didn't die. So I'm okay. I'll do a workout, right? And I'll monitor my heart rate the whole time. And hey, the heart rate went up. I did 10 miles on the Peloton, not dead yet. Okay, I must be okay. But Dr. Tiffany really touched on it. You really got to do the therapy. You've got to go back to the CBT and examine the evidence, right? What is this? What are those things that argue against me having a heart attack in this moment? What are those things that argue for it? And really got to be very practical about that. But at some point, and I had to do this with various therapists and a current life coaches, you've got to go back and you got to look at that initial core wound, right? What was that childhood wound that made you so afraid that you weren't going to be okay?
That's right.
And for me, that core wound was being separated from my mom, right? When I was a kid, I had horrible separation anxiety. And my mom was always, her entire life, she was sick. She had lupus. And so she was in and out of the hospital her entire life. And there's one time in particular, she went away for 3 months. And at that point, I didn't know if she was coming back. And as a little boy, I just didn't think I was going to be okay. And I didn't know when I was going to be okay ever again, because if mom's not here to take care of me, right? Who's going to take care of me? And it was deeper than that for me. Okay, now who's going to be left to love me? Right? And so that was where it came from for me. And I'll be honest with you, Doc, we're friends. That was the first time I ever had the thought that I wanted to be a doctor, because I wanted to save my mom and I wanted to keep her from leaving me. And if I could do that, then maybe I could be okay.
Wow. So powerful. And my question to you is that you really have identified the trigger and that it's been an ongoing struggle. Is that helping that you sort of have pinpointed it? Or
it does, because once it's like with our patients, right? Once they tell us where it hurts, right? Now we're on the job. Now we can diagnose it, and now we know what to do to treat it. So once you know exactly where to look, where the pain is coming from, right? You can go back and you can heal those childhood wounds. You can have those. I can have those conversations with that 3-year-old little boy inside me and let him know that he's going to be okay, and let him know that he's always going to be loved, right? Whether mom's here or mom's not. And so when as psychiatrists and as doctors, when we talk about doing the work, that's the work you've got to do when it comes to healing that core childhood wound.
Dr. Ish, we love you. We're family here and we're rooting for you. And we're here for you to do anything we can. Thank you so much for sharing.
Yes, sir. I appreciate that, my friend. Thanks, Dr. Tiffany.
Always.
Yeah.
Thank you.
Dr. Sizemore, thanks for coming back. Always great insight.
Appreciate it. Thanks so much.